if you would like. Thanks everyone for being here today at another Institute on Aging training. Today, we welcome two trainers with Senior Care Authority, Loretta Rotolo and DJ Culver. I'm sorry, I got your name wrong. Loretta has worked in the health and human service field in direct service roles as a therapist and advocate, as well as in management capacities. And DJ is a board certified patient advocate who graduated from the Healthcare Navigation Program at Sonoma State University. At this point, I will bow out and let the two of them take over. And again, if you have questions, go ahead and put those in the chat or the Q&A feature, and I will pose those to the speakers at the end. Thank you.
Thank you. I'm DJ, and thank you for having us, Caitlin. And I can't see you all, so I'm imagining you're smiling at us and happy we're here. Loretta and I are happy to be here. We work for Senior Care Authority, and what Senior Care Authority provides is the placement. We help with placement when our loved ones need to have us. Their circumstances are such that the living at home is no longer safe. We also provide elder care consulting, which provides more support either in the home or when they do move to assisted living or care homes or whatever kind of special needs are required, and very big on problem solving. And the other thing we'll talk about today is Beyond Driving with Dignity, which is the opportunity to provide a self-assessment in somebody's home. When driving looks like it might be something to have a safety discussion about. And we'll talk about that this whole hour. Do we want to show our slides? The training we're doing this week is driving under the influence of dementia. As I'm sure, because we're all working in the field with dementia, I'm sure I'm looking for our slides though.
I have it up on the screen.
Is it shared?
Hi, Loretta. This is Catlin. If you go to the bottom of your screen, there's it should be, there you go. Okay.
Oh, I'm sorry.
No, not at all.
Yeah.
We're all relaxed here.
Okay.
And
Sorry.
Sure.
Thank you. So basically what we're going to cover is mild cognitive impairment in the older driver versus dementia in the older driver, and what the differentiation is as we see it, and memory and executive functioning and how that impacts the decision making and driving, and some ideas and tips on how to go about communicating and observing what you see when you're working in the field. Some of the things that we've been discovering, first of all, let me say that Beyond Driving with Dignity and this program was created by a now retired highway patrolman from the state of Ohio. And we now work with him exclusively, and he has been providing not only these trainings, but the services of the self-assessment for over a decade, and has discovered that it's amazing how many of us are looking at this part of our life and our driving experience as we age. Over 20% of the population is expected to be over 65 in the next 8 years. That's not very far away. And according to the U.S. Department of Transportation, an average of 500 adults are injured every day in car accidents. We can look at outliving our safe driving abilities 7 to 10 years because we are living longer. Now, COVID notwithstanding, that might have an impact, but not much.
So hi, I'm Loretta, and one of the things we wanted to start with was to talk about what is mild cognitive impairment, or MCI, also referred to as early dementia. So it often involves problems with memory, language, cognitive functions, daily living functions. And although people that have mild cognitive impairment might have some deficits, they exhibit decline beyond what is expected to be normal for their age. So, but many people with MCI, as we know, can function fairly normally, don't really have needs for any assistance in their day-to-day lives, and don't yet meet the criteria for dementia.
And Loretta, this is Catlin. Could you increase your volume just a little bit? That is great information to have. We don't want to miss a drop of this information.
Right, I'm sorry, I don't know. Well, I will try, yeah.
Okay.
I hope this is a little bit better.
Yeah, thank you.
So the question is, unlike those with full-blown dementia, people that have the MCI, mild cognitive impairment, are obviously still able to function, like we said, in their daily lives, and can be fairly independent, and can probably still drive safely. But is it safe to be driving if you have mild cognitive impairment? And, as we know, people can, their dementia may increase over time, their cognitive abilities continue to decline, but initially they have a similar range of driving ability as cognitively normal adults that are aging, according to the Center on Research on Aging and Health and Wellbeing in Australia. So again, we ask and wonder, is it safe for them to drive? Oh,
I am sure, sorry. I am sure that all of you, along with Loretta and I, see this and wonder about this often. We know that dementia raises the risk of accident as much as fivefold. We also know that based on the study at Sarasota Memorial Hospital, but there's a lot of other studies, that 3 out of 4 older people with dementia who continue to drive will eventually be involved in an accident. We know that. And it doesn't benefit our seniors or our loved ones when we're not willing to look and have these conversations that we're going to talk about. Some of the signs and symptoms of dementia, I'm sure all of you know, include obviously memory loss. Now, regular normal aging also has memory loss, but we're not talking about, I forgot, I went in that room, what did I forget? Why did I go in there? We're not talking about that kind of memory loss. We're talking about the kind of memory loss that includes, maybe we're forgetting our words more than just forgetfulness, faulty choice making, where our judgment isn't clear, we're not sure what day it is, what time it is, I'm not sure where I am or where I'm going. I know that those of you that are working in the field, you often will have a person that will say, they were just talking to so-and-so, and you know that so-and-so isn't there. Or that so-and-so has been dead for 55 years or whatever. We have, that comes under, hallucinations, paranoia, agitation, really just not being present in this moment in time with you. Off balance, not walking straight. You'll notice people that they're not showering, they're not clean, their hygiene is terrible. I traveled with my mom until she was not able to travel anymore to visit family in Iowa, and her cousin presented with all of these things, and nobody was identifying her as somebody that needed help. So that's the problem with, kind of denial. So what does that mean? focusing on, if a person is not able to focus and is not able to concentrate and is not in the same time and place as we are, and they're behind the wheel, it's extreme danger for them and others, obviously. Declining with age, losing our memory just with natural aging, our reaction time goes too. But when it's dementia that we have and a diagnosis of dementia, it accelerates the process, and the ability to communicate one day doesn't mean the next day they know where their gas pedal is and their brakes are. It definitely is a danger. So when the person with dementia whose skills are compromised and their disease is resulting in the need to limit and eventually stop driving, we know, based on obviously Baylor College of Medicine, as this says, we know that if we do not limit driving and these behaviors and these skills are diminished, it will lead to accidents. So, memory and the older driver.
There you go. So we want to talk about memory and how does that impact someone's ability to drive safely? And does it? Does it impact the ability to drive safely if it's a memory issue? Well, first we want to address what is the working definition of memory? You know, it's retaining information in an accessible state, right? So working memory is a very important skill, a quality that enables a driver to do the basic things that we do when we drive: follow driving directions, following the rules of the road, remembering what happens or what you're supposed to do at certain intersections, remembering how to merge onto a highway, making good decisions, and remembering what to do behind the wheel. And all of that, you know, includes the memory that's needed to keep an older driver from getting lost. So memory is a really important piece of being able to drive safely. Getting lost is a bigger issue than we realized it to be when it comes to driving. So memory in the older driver, according to this study that was done in Toronto, they say that memory impaired patients are more likely to cross the center line of the road and stray out of the legal driving lane than healthy drivers. And we're more likely to make mistakes turning left with oncoming traffic. So this is something that's really a concern when we start to notice, like DJ said, when the memory impairment becomes more advanced, it's very important to address to make sure people are staying safe when it puts people at a higher risk. Because what we find is working memory deficits are linked to a significant increase in car crashes. Now, this is through the American Journal of Nursing. And a lot of research is going into seeing how memory, when it becomes impaired, puts people at a higher risk in terms of getting into an accident. You know, very often we minimize and we kind of make a joke about short-term memory loss, you know, saying, oh, you know, she's having a senior moment, or we make light of it like, you know, if smoking marijuana causes short-term memory loss, what does smoking marijuana do? Anybody? So yes, there are times that we can make light of it and say, oh, you know, short-term memory loss is not something to really be concerned about. However, you know, people, as they progress in their disease or their cognitive impairment becomes more evident, their memory issues become more advanced. And they might say, well, what's the big deal? So what if my memory is bad? I can still drive safely. I still know how to turn on the car, and I know how to park, and I still know how to drive on the road. So what is the problem? Why does my memory have anything to do with that?
Right. I have a friend who recently was diagnosed with dementia, profound dementia, and he's been a friend of mine for 40 years. And he had his diagnosis, and he didn't even know who was giving. He just thought there was these two weird little old ladies at his doctor's building and who were they? Well, they were the neurologist. And they told him that he was going to have to stop driving, and they were going to report him to the DMV. And he was just beside himself. And I said to him, I offered him to lead him through a self-assessment about driving so he could see it for himself. And this literally was his biggest question. I have been driving for 50 years. I have never had an accident. I have never gotten a ticket. I've been driving longer than most of these people have been alive. This isn't really a beneficial statement. Driving isn't what it was 50 years ago. The amount of cars on our roads wasn't it's just not the same thing. So I helped him see by doing the assessment, and that's the benefit of this assessment, is helps the senior see, the driver see by themselves, based on a lot of criteria that we go through, their own memory loss and how that might impact safe choices. He was telling me that I asked him to answer a bunch of questions that you or I could answer safely, and he couldn't answer them. He couldn't draw a clock. He couldn't tell the time by looking at his clock on the wall. He did not know what day it was. I asked him if he ever got lost when he was driving, and yes, he did. I asked him if he ever got lost and didn't know what to do next, and he said yes, he did, but he would just wait. He'd pull over and wait. He wasn't causing anybody any problems. However, I pointed out that if that's the case, what if at some point your memory impaired you in such a way you didn't remember which was the gas and which was the brake, or which was turning right and which was turning left? What if for some reason you forgot that you were in a car? What if you forgot that wasn't a TV you were watching? Those were actual people walking across the street. That is what we're talking about when we talk about memory loss. And so these are some examples of what we're talking about. What some of the really horrible, these are just a few examples, and I'm telling you, these happen every day around the country. So an elderly man got lost. He was driving, and he drove onto the campus at Montana State University. That is not where he was going. He drove off the road onto the pedestrian pathway and couldn't find his way out, and ended up going down some stairs in his car, and obviously came to a sudden stop, not by his choice. The only blessing in this situation is school was out and there weren't tons of students walking the campus. But you can see what a tragedy this could have been. And then there's another incident of this gentleman. These are all very true stories. 93 years old with dementia, went missing because the keys were still available. The car was still in the driveway. Gets in the car, is missing. This is a big news story in the area, and they find him. This is his car. This image is his car. Found him dead the next day in the state of Michigan. How did he get there? He didn't even know where he was going. And this is another tragic. These are stories that happen all the time. This is in the Northwest in Washington State. And this couple and these people had some memory loss, and they had made an agreement with their family that they only drove between this daughter's house and their house because they knew how to do that. And yet they got lost going point A to point B, the only point A, point B that they were allowed to drive in. Gets lost, ends up in a farm field. He gets out of the car with his cane, looking for a way out or looking for help. He doesn't come back, and she gets out of the car and goes looking for him, and they found their bodies feet apart, frozen to death. This is not as unusual as I wish it were. So there's another story. So the Tuskegee, you do see the commonality in the ages by any stretch. So having a long history of driving doesn't necessarily make you a safe driver. 93-year-old Tuskegee Airman. Again, this was a gentleman who was driving to his daughter's house, a place he knew, and he got lost. And he stopped to get help, and the first person that he stopped to get help from robbed him. And then he went following the robber. Got back in the car, went following the robber, and asked for more help when he saw these two other guys. They took his car. Now, he lived to see another day, but imagine being this 93-year-old, that kind of terror, what that looks like and what that feels like. We don't want that for our loved ones. Even if they don't get hurt or don't hurt somebody, the terror and the fear and it's kind of unimaginable.
So now we want to talk about the overarching theme of executive functioning and the older driver. And this is just kind of a summary of all the skills that executive functioning in the brain controls, right? So the brain functions, the executive functioning piece it really combines all of these important skills, the ability to plan and solve problems and be able to organize your thoughts and direct your body to do certain things that you want to do and initiate things, make good decisions, being able to consider consequences, look at situations and make decisions that are safe and consider what can happen. It includes the working memory that we've been talking about. It helps with prioritizing, being able to pay attention and not be distracted. We all know how much is needed when you're driving in terms of staying focused and being aware of everything around you. Being able to focus on important details, like is there an emergency vehicle coming down the road, and ways to focus and make decisions, and being able to shift from one step to another. Like first I'm going to turn right, and then I'm going to stop at this light, and then I'm going to turn right again, and being able to know the sequence of events. All of this falls under executive functioning, which is, basically this is the brain CEO, as we call it, and it combines all of these things. All of this is necessary for driving safely, for daily living skills as it is, but for driving, all of these pieces are extremely important. So when all of this is working well, we are able to manage our activities and we're able to drive safely because we can access all these skills. That's what we have with executive functioning, when the brain is not impaired and able to work in a normal way. But what we have to look at is with cognitive impairment and dementia, where executive functioning starts to decline in people, decisions are not always appropriate, like DJ gave examples of. For some people are driving and they're not turning on the windshield wipers when it starts to rain. These are all examples of poor executive functioning. Driving slow because the person they're driving with is talking to them and they slow down because they have a hard time multitasking or doing multiple things at once and shifting their focus. Stopping in the middle of an intersection because they lost their bearings about where I am, what am I supposed to do, where was I going? Some people just stop. Like DJ's friend just has to pull over. What if he stops in the middle of an intersection to try and get his bearings again? And the other concern is how well are they going to respond in a situation where there's an emergency vehicle coming in? The executive functioning, when it's impaired, impacts their ability to make an appropriate response in those situations, to pull over, to move, to do what we all know to do. And that is when driving becomes unsafe. So we know when there is this decline in judgment and decision making, when we're not able to predict the consequences and anticipate things that are going to happen and handle these multiple things at once and be able to multitask and access all of these skills, when there's a decline in that area, it is unsafe to be driving. So it certainly does impair driving skills. And so when executive functioning and these kind of processing abilities are looked at, you know, in the University of Miami, it was the explanation for a lot of crashes that elderly drivers were involved in. And the results from this study done by the Journal of Clinical and Experimental Neuropsychology was showing that elderly drivers that had a history of accidents had a poorer performance on the cognitive measurements of executive functioning. And that's why we feel, and what we do in our program, you know, is measure, find out if there is a way to sit down with a person and really measure their executive functioning skills to be able to really evaluate their driving competence. That's what these kind of programs are for. We want to be able to determine whether or not the person has diminished driving skills and as a result may be at risk for a future traffic accident.
How do we talk to somebody about our driving concerns? When a while after Craig had that assessment with me, he called me in a complete panic because the DMV wouldn't let, he had gone to the DMV for an appointment he thought he had to try and get his license back. And he called me in a panic. And when I got to his house, he was showing mail that was old that he thought he just got out of the P.O. box. And he was on the phone with the DMV, who was losing their patience with him because they didn't like the way he talked to them. So how do we talk to him? We are kind, we are patient, we are empathic and compassionate, and keeping things very simple. Not long, large, detailed explanations. And when we are beginning to talk about somebody who we would like them to retire their driving, or at least be in consideration and begin the conversation, we would like to give them choices, options on how they're not going to be trapped in their home. Because this is the biggest thing. I'm sure all of you that work in the field know this. This is the number one loss. This is the biggest thing that happens in our aging, is the giving up our keys and losing our autonomy and our independence, the biggest fear of all. So what do we do with that? Well, we find nice ways to remind the person that we care about them, we respect them, and we give a very simple example of what our concern is. Hey, you know, when I was in the car with you the other day, I got really frightened when you went through a red sign, you know, the stop sign. Or like what Loretta said earlier, might be, you know, it wasn't raining and you had the windshield wipers on and you never noticed. Makes me worried. That kind of a thing. Who should do the talking? Well, we would like to say, you know, I know a lot of the people we meet up with might come from adult children. The last thing an adult parent wants is in their adult child to start telling them what to do. You will find that, I'm sure you've seen it in your work. That's a big bump. So maybe what it is talking to friends, their peers, if they still have some that they have respect and care with. Doctors, you're going to find a lot of doctors don't want to have this conversation. But maybe in your world you find one that does and is ready and willing. Nurses, family attorney, state attorneys, people that they've had a decades relationship with, that they have a respect for them because of, a lot of older people, and I mean older than me, I'm old, but older than me, have a certain respect and deference to attorneys, doctors, uh, ministers, therapists, things like that. So who has a relationship of influence? And I think Loretta, you had a story.
Yes, and that had reminded me of the situation where working with adult children who were having to have or planning to have a difficult conversation with their 90-year-old mom about the fact that they were concerned about her living alone and wanting her to move to a place where she would be safe. But they were very concerned, just like DJ said, about, well, she's not going to listen to us. She doesn't like when we tell her these things. And when we, sat down and talked, well, who would mom listen to? Who does she respect that she might actually consider their opinion and take their advice? Who would that be? And they kind of looked at each other, and one said, you know what? My ex-husband is still very close to my mom and she adores him. And now that I think of it, he's the only one she will listen to. And so sometimes it's someone that you least expect that could make the difference, but the idea is to bring up the subject.
Mhm. Yep, thank you. And so when, how, that there's not like a particular date in the series of events that every situation is going to be unique. Every individual is unique. And so it's what we don't want to do is go like this example. Hey, you're a crappy driver. I don't think you should be driving anymore. That is not going to land well. That's not going to be heard. And all we're going to get is pushback. But it is clear that if we are kind, compassionate, present to the fact that we're talking to somebody we care about and we would like them to hear us, then it really comes like, I statements are really important. I was concerned when it made me nervous when you turned left in front of those oncoming cars. And I didn't know you were going to turn left. You didn't have a blinker on, and they didn't know so either. And that's scary for me, And I'm afraid for you. Something like that. If it comes from a place of vulnerability, our own vulnerability, then they're not feeling attacked. Hopefully, the person we're trying to approach won't feel attacked. So finding those ways of clear, concise, kind details.
And you had a story also, DJ, about someone that made a turn like that you were just
Dad,
describing.
thank you for reminding me. So my father did this very thing and terrified me. I will tell you, I was not in the car with him. I'd already given up riding with him. But I had been in LA visiting he and his girlfriend at the time. When we had dinner, we were on a large artery in LA, going to turn left on another very large artery, and it was nighttime. And I was following my dad, and he was in the right lane, so I was in the right lane. And all of a sudden, he turns left in front of traffic. He did this very thing. No blinker, or I would have known to be in maybe a different lane. And off he goes. Well, I did not follow him. I went straight across the intersection, and because he drove like Mr. Magoo, if you don't know who that is, he drove very slowly, and however he felt like, and I went around the block and caught up with him and followed him home. And I had to put my very best behavior on so that I didn't take his keys right there. It terrified me. But what I'm sure it did was terrify the other people on the road too. And it was just a miracle that no one got hurt. There were a lot of those miracles with my dad. So maybe I shouldn't be driving. I would have liked him to say.
Yeah, so that's the tip number one, is that we would like to have the conversation so that the person will come to that decision on their own. Another tip we wanted to share that we've been learning a lot more about is how people who are fall risks are at risk of accidents as well. You know, the CDC tells us that 1 out of 3 adults over the age of 65 fall every year. That's a lot of people who are considered fall risks. And so the research shows that older drivers who fell 2 or more times in the prior year were 1.5 times more as likely to be involved in an accident, and 2 times as likely to be involved in an accident where it was their fault. So the bottom line is history of frequent falling. It is very clear indicator to identify older drivers that are at risk for a traffic accident. And that's from the School of Public Health of the University of Alabama. And this could be related to physical limitations. They might have slower response time because of whatever the physical condition or medical condition makes them fall. You know, maybe they have a lack of coordination. They have some weakness in their extremities. They don't have the ability to coordinate their hands, their feet. And so these things make them a fall risk. Also, the falls can be related to medications. Sometimes it's not about a medical or health condition, but maybe they're falling because of the prescription cocktails that so many people over the age of 65 are prescribed each year or taking. 95% of seniors use medications that impair driving. That's very scary information from the AAA Foundation. 95%. And in this study from the University of Alabama, where they studied 630 older adults around age 70, only 28% acknowledged that they had some awareness that their medications might be impacting their driving. A lot of people don't realize it. They're so used to taking these medications that it's hard for them to even imagine that would be an issue that would cause them to be unsafe on the road. And there was an article even in the Washington Post. Do you have that information, DJ, to share?
Yeah. So this is it's a great article. It's from 2017. If you would like to look it up, it's called "The Other Big Drug Problem: Older People Taking Too Many Pills." And there are a number of things cited in here, but one of them was at least 15% of seniors seeking care annually from doctors or hospitals have suffered a medication problem. In half of these cases, the problem is believed to be potentially preventable. You know, it's a series of events. There's, first of all, the volume of drugs. Let's say there's an incident, you've got your medication managed, and now you have an incident and you're in the hospital, and now you get new medication, but that hospital doesn't know what your other drugs are that you're taking, and they send you home with a boatload of drugs, and you take that on top of what you're already taking, but nobody has sussed it out. And so now you might be having a drug cocktail that really is throwing you off. And then that looks perhaps like another ailment that's another doctor is going to give you drugs for, rather than looking at maybe all of these behaviors or all of these incidents that this individual is experiencing is related to the medication. So there's a culture in our medical story here in the United States where we don't challenge doctors. Doctors don't look at their own behavior about writing prescriptions. They don't necessarily have the knowledge. They're not looking at a pharmacy. There's just so many ways that the medication is impacting driving, is bottom line. This is an article I really encourage you to find. It's in Washington Post.
The other thing that's interesting is that, you know, we don't even think a lot of times of the over-the-counter medications that people are taking on top of their regular meds because they feel that they're safe and it's just my allergy medication. But the other thing, the information from this article and research that's done is older people have a greater difficulty metabolizing medicines and are more likely to suffer dizziness, confusion, and falls, like we talked about. So falls could be related to the medication that they're on. And, so this is an issue that we have to make sure we address and be mindful of, and maybe share this information with families and let them know about this. This is a great resource for families to use. It's a tool that you can learn more about how your medications affect your driving. You go to the site Roadwise RX, and you can put in the medications you're taking, and the information should come up about what are some of the side effects, and it may shine the light on things for people. It may be another way to have that conversation.
So, at most, a retirement from driving might mean a loss of convenience. However, it should never mean a loss of independence. And that's where Beyond Driving with Dignity comes in. My mom, I know I keep talking about her, but she had macular degeneration and glaucoma. So her loss of independence wasn't from dementia. It was her vision. And she had driven my whole life. My mom was an independent driver, drove cross country every year to visit family. And the two biggest losses that vision brought her were losing driving and losing reading, her two great loves. And when that happened, when it was obvious that she was going to have to retire from driving, she really did fight it all the way to the end. However, it became apparent. She came up with a date that she was going to surrender, but she didn't tell us exactly what day. And prior to giving us her keys, she by herself found out paratransit in her town. She had started taking paratransit to her, she was a very big social butterfly, to her events. And in the process, met somebody, a blind person on the bus, on the paratransit, who turned her on to a place called the Earl Baum Society Center in Santa Rosa, where she signed herself up and went 4 times a week and learned how to live without vision. And then she told us about it. She did that on her own. She discovered for herself that she was able to keep her independence and her autonomy. And what that taught me, and those of us that I talk to, is that there are ways and means to keep somebody going in their social life, in the interest that they still have and want to participate in, and still be able to do it without us making it happen for them or us being the only source of support.
And so, like DJ described, there could be 2 different reactions. So when you have a conversation about retiring from driving, there's the expression is, whether you think you can or you think you can't, you're probably right. And so in this situation, if someone is empowered to come up with alternatives and other things that they can do to maintain their lives and their activities and their independence, that's going to make them more likely to kind of take it in a better way than someone who basically, digs their heels in. And like we had someone come up when we did a presentation and said, nobody's going to tell me that I have to stop driving. That's the last thing that's going to happen. And I will continue to drive until I think it's time to stop. Was not open to any alternatives, was not open to the conversation. But either way, there is a high incidence, obviously, of depression associated with people who have to give up their ability to drive. But there's ways to help them come to this on their own and where they feel more empowered.
Mm-hmm. So Enhanced Self-Assessment Program for Older Drivers is this program that Matt Gerwell created that we now work exclusively with Matt, who is one of our favorite humans, by the way. And, the self-assessment literally is that. We will come into a person's home at their request or at their agreed request with their kids or whomever, And it's 2.5 hours long, about, depending on the person. It's a lot of talking. There are lots of questions to answer. We keep copious notes, details, and in the during that period of time, um, we will at the end of the meeting say, what we see and what we think is probably a good idea. And that doesn't mean that that's what's going to happen. It's not up to us for that to determine for that person if they're going to retire from driving, but we can tell them what we see. And it could come up like this, maybe you could still drive, but I would, recommend, you kind of limit where you're going to drive and what time of day, and you pick 2 or 3 places that you go regularly. Or we might say, based on what I see, I would not recommend you ever get behind the wheel again. And when I say that, I do say, but here's some other options. I would come prepared with options just in case. I would do my research for what town this person lives in, what I know about this person in advance of meeting them. I wouldn't meet them cold. I would have information about them, and I would kind of have a plan in case what results in our time together is that suggestion. However, the choice is always the driver's. And then we provide a very detailed report, written report, that goes to the driver and any family members they let us, and at with their permission, their doctor with permission, physical therapist, even the DMV with permission. So that was it.
And and that's why we try and look at it that aging is a triumph, not a tragedy, and empowering people throughout the lifespan is always important. And if we can get people to actually come to that decision on their own and give them tools and specific reasons for what we think is the truth, then it could be a better situation for all of us. And so we just wanted to wrap up with that, and hopefully we have time still to take some questions. Uh, this is our contact information if you have any if we don't get to your question today. And I'm going to give it back to Caitlin to maybe bring up some of the questions that some of our attendees might have for us.
Thanks, Loretta. Thanks, DJ. This was very helpful. I'm sure we'll have a few questions further about the assessment itself, and people will probably reach out to you about that. But I also wanted to say that if you could speak a little bit about how and why Matt Gerwell created this Beyond Driving with Dignity program. He's now a retired Ohio State Trooper, but I guess he developed this as a result of witnessing the outcome of people driving with cognitive deficit. Is that correct?
That is correct. Loretta, do you want to address that?
Well, I think that he, over the course of his career, Matt became really concerned and very frustrated that he was, on the scene of many of these kind of car crashes that were often fatal, that could have been prevented if someone had intervened, or if there was more knowledge and assessments done of people's cognitive abilities to prevent some of these. I think that's what motivated him most to start the program as a way of educating others and helping to really become more aware of this as an issue, and that is something that we all need to pay attention to keep not only the older drivers safe, but the rest of us on the road safe. Do
Yeah.
you have anything to add to that?
I was going to say that, he had, I think his experience is, and he's done hundreds and hundreds of these, is that there's a 80% of the people that do the driving assessment will self-identify and retire on their own without feeling like somebody's taking it from them. It has to do with giving them the opportunity to make their own well-informed choice.
Mhm.
And I think that gives him a lot of comfort, Matt in particular.
Great. We have a question from Alex, and she wants to know, do you keep data on the percentage of drivers who you recommend stop driving through your assessment? And what is the data that tells you how they actually stop driving? So can you answer that?
Yeah, well, I think 80% will surrender. There's a percentage, a smaller percentage that won't, and there's another percentage, and it's a good percentage that will. It's kind of like we were with Matt during our training with a person in our area who clearly needed to retire his right to drive. And he did eventually, but he didn't do it right away. The very next day, Marcy saw him driving down the street. But it's just like we said, it's the last thing they want to lose. And some of them are going to say, I just want to drive one more month. Or what they'll say is, I'll think about it. And we offer another test, another assessment, another assessment afterwards for free if they want to reevaluate in 3 or 6 months. It's
that brings, sorry, go ahead.
it's a high result of people who end up surrendering or retiring their license. But I don't remember the numbers exactly, but we can get that to you.
Yeah, that might be helpful to send out to the audience. That would be great.
Yeah, Matt keeps all records.
Good. Yeah, okay.
And the thing
Also, I'm
go
sorry, go ahead.
And the thing about the self-assessment that is so good is that when DJ said, we take all these notes and we provide this full report, pages long, of the whole interview process and questions. There are specific cognitive exercises included in this self-assessment. So they are specific things that we can refer to with the client and say, well, when we asked you to do this, this is what you did. And when we asked you to do that, and showing them the paper that they're writing on and what they wrote and what they did, is that confirmation for a lot of people. Seeing that in black and white makes a difference too.
Okay. And you said that if there were a second test, that could be done then at no charge. So that brings me to the question that someone asked, is there a fee for this initial program?
Yes, there is. It's $500. It's It's a very extensive test. So of course the second one is free. The reporting is all included. Follow-up is included. Was there another question part of that?
Yes, there is. There's another question from that same person who asked about the fee. If you feel a person should stop driving and that person chooses not to, you're probably mandated reporters and you have to report about to APS or another entity about their safety. Is that correct?
No.
Okay.
The self-assessment.
Okay. All right.
We can tell them what we see.
Mm-hmm.
We can't mandate anything.
Right, and we make the recommendations very clear.
Okay. I'm going to ask a question piggybacking onto that then. So when you're conducting this assessment with the party in question, is this an intimate event where there are no family members or other people around? Is that correct?
That's correct. It's just one of us and the individual, and yeah, it has to be like that.
So then the person who is taking the test is the person who's contacting you saying, I feel like I might be having some cognitive issues. I want this test. Or is it a case manager or is it a family member contacting you to have this one-on-one with them?
Usually it's a family member. Usually it's a family member, or it could be one of you. It could be one of you who's dealing with a senior and you see this and you're talking to a family member or something like that. So while it might be, however, the test or the assessment is because the senior agrees to it. not because they're forced to.
Right. And we
Right.
also, we're doing a lot of outreach to physicians and offices and medical facilities to make them aware and to do presentations for them so that if they are reluctant to have the conversation, but they also have concerns about, the person's cognitive abilities, or maybe because they're on new medications and they know they're not as stable, then we are asking the doctors to share the information with the patient and their family and say, I really recommend that you contact these people and have a self-assessment done to determine if you're safe enough to continue driving.
Mhm.
So that's what we're hoping to increase that awareness.
Mhm.
And the success rate of managing or deterring somebody from hitting the road or getting back on the road is about an 80% success rate. Is that right, DJ? Is that what you?
Yeah, yeah. That's according, Matt has kept very detailed records on every single assessment that anybody's done, including himself.
Over a 10-year
What-
period, right?
Yeah, he's got a large. So that's what I said. We will get you those exact numbers for your folks.
That would be great, because I also have this final question here that is related to your stats, and it is, how often does the older adult that you're assessing refuse the assessment? Do you keep track of that?
Yep.
Okay, all right.
Yeah, the assessment, it's a self-assessment, meaning it's their assessment. We're guiding the assessment. We can give our opinion based on all the results of all these questions and all this testing that we do with them, but it's their decision. It's what they agree to. We cannot mandate anything. And but that's those are the records that Matt, he keeps great. He knows what the assessment said, no matter who provided the assessment. He knows what the recommendations are, and he knows what the results are.
And sometimes the client might want to go through the self-assessment just to prove to their family members that they're fine. And then maybe find out by the end of the test that, oh, wow, I guess I have more deficits or impairment than I even realized. So they could be
Plus,
different.
plus, there's people that really are okay to drive,
Mhm.
that do this assessment, but their kids think this or their spouse thinks that. And it doesn't necessarily mean what they see is accurate.
Right. Well, I'm sure that I and others have more questions, but we're out of our time. So I see that your contact information is here. So I would encourage the audience, if you have questions, take a screenshot of that information. I'll send it along to everybody too, so that we know how to get a hold of you again.
Yeah.
And this
And
is
we encourage people to, to check out the website. Even just going to seniorcareauthority.com, the Beyond Driving with Dignity program is on our website, so they can read more about it on there as well.
right. Okay. And of course, some of the people here may see you next week in the next this. So I want to thank you right now, DJ and Loretta, for being with us today. We will definitely stay in touch. And we'll be taking a survey after this. We'll share the outcome of those with you. And Loretta, if you would like to stop the recording now, that would be great. Thank you.
Yes.